Welcome back to Rural Health Summit, a season of Rural Health Today. In this season, we're sitting down with a series of guests at the MHA Annual Summit meeting, where many healthcare executives and leaders across the state meet to review the last year of collaborative efforts and the work that we've accomplished. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and to touch base, so to speak, on the healthcare issues they see that is most pressing in their corner of the rural health world. Welcome to another episode of our Summit series. Today we're talking with a good friend of Hillsdale Hospital, someone who fought in the state legislature for rural health, and very, very pleased with many of the votes that you took and the advocacy that you gave rural America. You did a great job. None other than Benjamin Frederick, that we have the honor of having on the podcast today. Just previous to this, his CEO was on the podcast sharing what he has faced in the last year. And Ben, we're going to kind of transition the conversation a little bit into, all right, we talked about what are the pressing issues, what are the great things that Memorial has done, which has been phenomenal, by the way. But now I want to really pick your brain with a couple issues. Number one, I want to ask you, as you look at your health system, what's a future look like? You know, there's a lot that you do, but before you answer that, I'd like for you to share a little bit about your background and what you do at Memorial, if you would, please, for the listener who may not know you.
I'd be happy to, JJ, and it's a delight to be back with you and the team again. Truly appreciate the invitation. Again, I come from a background of over 20 years in the state legislature. First 14 years in the staff side, on the staff side, House and Senate. Always keeping my home in Shiawassee County, rural Shiawassee and Owasso. Worked in the Senate, worked in the House. Then I had the privilege of being mayor in Owasso, and then later serving in the state legislature as a state representative representing Shiawassee County and rural Saginaw for 3 terms. Had the ability to close my service as majority floor leader in leadership in the House. So truly a wonderful arc. Always kept my home in Owasso and then returned to Owasso with this marvelous opportunity to take and build a advocacy program for our premier independent hospital, Memorial Healthcare, the healthcare system where I was born, my mother, my kids, family treated. You know, you get it, right? And certainly Hillsdale has the multi-generational too, but quite motivating when conversations occurred there about possibilities to lend a voice to Memorial and really think about the differentiators and help to thread that needle for a very unique hospital system, as was mentioned by Tom earlier, not in the critical access space, not a massive system, really that community hospital agency. So really been building the plane as it's been flying the last 2.5 years. It's just really whizzed by. So
it's been 2.5.
It has already, and very rewarding work in the grant space and in the state federal advocacy space, making sure that we're fully eligible for rural funds at the state level, partnerships, stakeholder engagement. Been a lot of different things, certainly, but very fulfilling work.
Yeah, and President Kurtz talked a lot about the great successes, and I had a chance, and I said on his podcast that I had a chance to view your recent opening of your retail pharmacy. You're serving some care deserts in your community, and that's what rural health's all about. It's about addressing the need, and we have some challenges. I want your perspective as a former legislator. There's a lot of things going on in this country right now, and some of them are extremely concerning. And it doesn't matter which side of the aisle you're on, if you're on the left, the right. But Ben, you know for a fact that you have to cross aisles at some time to compromise. And so, I'm going to challenge you to maybe answer it in the vacuum that you're now in. You had a whole different perspective, Ben, when you were in the legislature, and we can appreciate that. But, as you look at it now from a different lens, do you have any different insight?
I think so, for sure. I think one of the initial surprises I had coming from the legislative vein to the hospital vein was this thought process about consternation or dogmatism about single payer and what's driving decisions. There's dogmatism about, are we in a single payer environment? Are we not? And when I realized, and again, the leadership team did a wonderful job of answering questions and helping me out to get schooled in this stuff. How much the Center for Medicaid and Medicare really do determine the actions of healthcare. And we all have very high payer mix representations of Medicare and Medicaid.
Yeah.
We're above 60% at Memorial. Others are higher. That determines the decisions.
It does.
And so to be engaged and have both sides of the aisle, robustly engaged in conversations on oversight, on outcomes, on how Medicaid, Medicare are being administered, on how Medicare Advantage contracted entities are honoring that commitment. Those are things that would not have come to mind previous as intensely. But when you see the other end of it and you realize what's really driving decisions, that was the big eye opener for me.
Yeah.
And I think that's probably the biggest realization I had.
Yeah. So let's talk about what's next. So we addressed the things that have been done. We've addressed our current state of affairs, and your CEO did a great job at identifying what those were. Let's talk about what is next for your organization. What are you most excited about? What do you see in the coming year?
What I'm excited about is the continued dynamic, vertical integration and growth potential that the system model has started to facilitate. It's really in its infancy, and yet we're seeing strides toward partnerships, real robust conversations now at the leadership level about strategic growth opportunities, whether it be primary service-based growth, regional considerations, real estate, joint ventures, number of partnership opportunities. So just that way of, creating that sustainability that all goes back to the service of supporting Memorial Healthcare Hospital as an ongoing concern is really exciting because, as I mentioned earlier, when we are so reliant, or if that is increasingly what you're relying upon for revenue, is a dwindling model or a challenged model with whether it's federal reimbursement or some challenge with some of the major commercial payers, you're really creating a fragility in that funding. So I'm excited about that. The challenge has been well covered, which is erosion possibilities represented in the conversations around Medicaid expansion and diminishing of some of those major ways, the scaffolding of funding. Medicaid expansion was a huge lifeline to hospitals on turning what were formerly uninsured write-off type situations into something that has a basic level of reimbursement. And these types of changes, bringing that population back into uninsured status, it doesn't mean they're not going to continue to frequent the emergency rooms. They're going to continue to,
yes,
obviously, and we will provide care.
As we're required to, absolutely.
But there'll be an increasing diminished resiliency from that model.
Yeah.
So that's a key challenge. And I think overall, just generally, there's a complexity to healthcare that is being lost in an environment of quick fixes and messaging that may be a bit surface level versus getting into the nuance of things. I don't think we're alone in that in the present environment, but I think healthcare is particularly vulnerable to it because hospital margins are already so thin if we're not negative. Yeah. So we can't afford a lot of disruption without some type of a sensible replacement when that disruption happens.
So, question, do politicians listen to their constituents?
I think politicians do listen to their constituents, but I think it's important to really define constituents. When I was in office, I would certainly entertain meetings with individuals and so on, but those that came from my home area would always have a bit more, as they should, a bit more attention, a bit more of that influence. And I think the storytelling that we do, storytelling that you're certainly doing, the testimonial type efforts that we're trying to do and others to make these human-centric stories and not just policy conversations. What's the practical outcome of supporting the drug pricing program, the 340B program? What's the practical outcome of a robust reimbursement that's at least allowing us to break even with Medicaid? It's the human stories. It's what was mentioned earlier, the maintenance of critical things that I think a lot of people think are just part of the landscape. Just having a birthing center in your community. If you grew up in Owasso, as I did, I'm a lifer there, it just was part of the landscape, like a police station or fire hall. Right. But we have operational necessities. We are not governmental in that nature. So that type of service. We have an inpatient behavioral health unit. We have a cancer center that wasn't there 20 years ago. No. So we went from a 45-minute drive for basic chemo to 5 minutes if you live in Owasso. That's right. To actually create like a cause and effect before it happens. Right. The challenge with government oftentimes is that there's a proof in the pain mindset, where how much displacement do we see, and then maybe
there's an inflection
we bring it back. Yeah. But when things are disrupted or dismantled in this critical area, can we get it back? And what damage has already been done by that? Right.
Well, I had a chance to look at your online website, and I got to tell you, I viewed a very powerful testimonial by one of your patients, and she spoke about, I believe it was a cancer center, and it was phenomenal. It was just an incredible patient story. We have to tell more of those because that's what we're doing every day, and through, obviously President Kurt's leadership, through the work that you're doing in advocacy and government relations, it all plays an important role in how we serve our patients each and every day. So, Ben, it's always a pleasure to have you in the studio. We'd love to have you back at Hillsdale again. Bring Tom with you if you would, please. I'd love to be able to give a great tour and maybe reciprocal. We can get a chance to get up on your campus. And we're a few independents left in this community in Michigan, and there's not very many of us left.
We have a podcast room on campus as well. We'd love to put that to use. But
right.
One of my goals, and I know we've already talked about this, those of us that do remain need to start talking more to one another. Those of the independents that remain, the rural independents generally. So that's a primary goal of mine moving into the future as well.
Well, if you've listened to the podcast ever, you certainly know that I preach against mergers and acquisitions for all the right reasons. And Kirsten's given me the look like, don't go there, but I have to because the importance of rural community engagement, the importance of rural autonomy and independence and decisions that we can make. Bigger isn't better. We've proven that. Your quality scores are very good. I've looked at your quality scores. Your finances are very good. I've looked at your 990. You're doing great things. You don't need a big system to tell you how to do business in a community that you've lived in all your life. So I'll leave it there at that. So it's been great to have you again. And until next time, remember the power of rule. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.